Hi everyone, my name is Mary Richards and welcome to my Applied Practice Experience presentation. Over the past few months, I have been working for a company called the National Minority Quality Forum. They are a nonprofit organization located in Washington, D.C., founded in 1998, and they conduct healthcare research to educate and advocate for groups across the United States who are disproportionately affected by various conditions and concerns. My specific preceptor was Michael DeSalvo Solarte, who is the program manager for NMQF's Center for Health Information Strategy and Services. Throughout this presentation, I'm going to say some acronyms, so I just want to place those here for reference. NMQF is National Minority Quality Forum. HISS is the Center for Health Information Strategy and Services, the department that I worked for. And then Clinical Trials Learning Community, that is something that was created between a partnership from NMQF and a global biotechnology company known as Biogen. This initiative focuses on collaborating with local stakeholders like doctors, government officials, community leaders, and industry professionals. And together they deliver essential training and education while also distributing public health resources. NMQF has also partnered with the Association of Black Cardiologists and created the Cardio Kidney Metabolic Disease Working Group to conduct research with the ultimate goal of reducing disparities in cardiovascular, kidney, and metabolic health among minoritized populations. So an issue that the company is exploring is clinical trial diversity, specifically related to lupus and Alzheimer's. Study results from trials need to apply to a broad range of people within a population, but as of 2022, African Americans accounted for only 15% of research participants, while Hispanics made up just 7.6%. Without proper representation, these data displaying the efficacy of unfamiliar vaccines, devices, and medications will appear incomplete. Another problem that we addressed was how years of systematic issues and historical mistreatment have led to minorities being unequally affected by chronic conditions. So NMQF is particularly focused on cardio-kidney metabolic diseases at the moment because Black individuals have a 20% higher risk of CKMD and are 2 to 4 times more likely to develop end-stage renal disease as well. The Center for Health Information Strategy and Services actually houses a private cloud data warehouse, which consists of 5 billion patient records. And the purpose of this center is to use evidence-based, data-driven methods to advance health equity, something that I was able to see during my time there. NMQF and Biogen also designed a platform together known as the Clinical Trials Index, which is a searchable database and visualization tool that maps regions of high prevalence of neurological diseases and comorbid conditions. This index can be used to see the exact issues a community is dealing with, so it can help professionals know where to implement interventions and what each zip code needs specifically. The 2 products I worked on throughout this experience were a manuscript and a pitch deck. The manuscript is a report advocating for the use of the clinical trials learning community to educate professionals with the goal of enhancing diversity in clinical studies and presenting research as a viable treatment option for their patients. The pitch deck is a presentation outlining the importance of the Cardio-Kidney Metabolic Disease Working Group. It is designed to hopefully promote sponsorship opportunities for funding research aimed at identifying gaps in the study of CKMD disparities within minority populations. The ultimate goal here is to eliminate health disparities, and by promoting clinical trials, underrepresented populations can access alternative treatments for their chronic conditions, leading to improved health outcomes altogether. And then identifying and addressing gaps in CKMD care will also further enhance these health outcomes. So a big lesson I learned and something I wanted to reflect on was my time learning about equity. And in an ideal world, we would aim for equality, providing everyone with the same resources, assuming it would lead to equal outcomes. But that's just not our reality right now. Some individuals need more support than others, and this is where equity comes into the frame. And that's why those in positions of power must advocate for and speak up on behalf of those who cannot. I also learned a lot about transdisciplinary work, which we've talked about in all of our classes, but it was so interesting to see it actually, in the works. NMQF constantly seeks to create partnerships with community leaders and local providers, shop owners, faith leaders, pharmacists, barbers, stylists, a lot of people. Collaboration with multiple disciplines often leads to more comprehensive and effective care and solutions. For challenges, the tasks I was planning to work on for my products changed slightly just due to the evolving nature of the work at NMQF and I'm sure anywhere else. There were just frequent adjustments to their own timelines and deadlines, which affected me as well, but it all worked out okay. Overall, it really was a wonderful experience, and I was definitely nervous at first, but Michael made me feel very welcome. And we were able to find times to meet each week despite our shifting schedules. And we were both flexible, and it was a great pair, I think. So in conclusion, the role at NMQF was a perfect fit for me. I currently work at a company that conducts clinical trials. So this summer at that company that I work for, I began doing patient recruitment. So the knowledge that I gained during this practicum has been incredibly relevant to my professional work. I hope to shift gears and pursue a career in global health once I'm done with my master's, and learning more about disparities through National Minority Quality Forum has only increased my interest in that field. Thank you everyone for watching, and I hope you enjoyed.